This presentation is about alterations in renal and urinary tract function in children and is by no means an exhaustive discussion. So just to go over a little bit about fluid and electrolyte balance in children, blood flow to the kidney is primarily through the nephrons in the medulla. Because there are short loops of Henle there, they produce a more dilute urine. Also, urinary excretion of urea is low. Because of a high hydrogen ion concentration, limited ability to regulate the internal environment, and a lowered osmotic pressure, the infant's renal system has a narrow chemical safety margin. Also, the immaturity and smaller surface area of the tubules also may diminish water reabsorption in response to antidiuretic hormone. An immature tubular transport capacity means that the ability to excrete potassium load, to reabsorb bicarbonate, or to buffer hydrogen with ammonia is much less efficient and does not become efficient until approximately age 2. Consequently, any disturbance such as diarrhea, infection, fasting for diagnostic tests, improper feeding can rapidly lead to severe acidosis and fluid imbalance because the infant can rapidly develop over or underhydration or edema. After birth, the proportion of total body water to body weight doesn't change significantly, but the location of water does. So extracellular fluid volume is nearly double that of an adult. A decrease in the extracellular fluid volume occurs during periods of rapid growth, such as in infancy and adolescence. And so total electrolyte concentration in extracellular fluids is greater in the newborn than in the adult. Adults take in and excrete approximately 2,000 milliliters of water a day, infants 600 to 700. And that makes control of dehydration and overhydration more difficult to contend with. This is just a list of some of the abnormalities we may see when there are urinary tract malformations. So other abnormalities we see in an infant at birth that could lead us to think about urinary tract malformations. Some congenital abnormalities involve the opening of the urethral meatus. Hypospadias is when it's on the ventral surface or undersurface of the penis. Epispadias can actually occur in males and females, and that means that the urethral opening is on the dorsal surface of the penis or on the cleft along the ventral urethra, which extends to the bladder neck in females. So twice as many boys have epispadias than girls. And those are surgically corrected. Polycystic kidney disease is an autosomal dominant disorder. It's congenital. There's cyst formation that can cause obstruction and then destruction of the renal parenchyma, which leads to fibrosis and loss of nephrons. Those children may need renal replacement therapy. Glomerulonephritis does occur in children, renal disorders in which there is a proliferation and inflammation of the glomeruli, secondary to immune mechanisms can occur. So they have sudden onset of hematuria with red blood cell counts and proteinuria, and then all the accompanying renal and salt and water retention symptoms. You can have chronic glomerulonephritis in children. It's a causative factor for 15 to 29% of children with renal failure. Post-streptococcal glomerulonephritis is common in children with a skin or throat infection where the antibody immune complexes and complement are deposited in the glomerulus, and that causes inflammation and glomerular injury, as I explained in the adult lecture. And that usually occurs in children 5 to 15 years of age. Immunoglobulin A nephropathy is a common form of glomerulonephritis, where there's deposition of IgA and complement proteins in the glomerulus. You have gross hematuria, and it's usually associated with a respiratory tract infection. They may need dialysis and may even end up with a transplantation. Nephrotic syndrome, I just want to mention, can be congenital, caused by an autosomal recessive mutation of the MPHS1 gene that encodes an immunoglobulin-like protein. And lack of that protein nephrin causes proteinuria. And that's usually shows up before 3 months of age. Kidney injury, chronic kidney injury can occur in very young children associated with congenital renal structural abnormalities. In older children, it's usually associated with the glomerular nephropathies, and treatment usually is peritoneal or hemodialysis and kidney transplantation if they develop end-stage renal disease. Wilms tumor is a type of tumor that's an embryonal tumor of the kidney, usually detected between 1 and 5 years of age, also called nephroblastoma. It's the most common solid tumor in children. Vesicoureteral reflux is an important thing to remember. Whenever you have children who are below the age of puberty, who develop urinary tract infections, think about a structural problem such as VUR. So flow of urine retrogrades from the bladder into the ureters or the kidneys, therefore they have a higher incidence of getting a UTI. So you have the infected urine from the bladder swept up into the kidneys, and that leads to frequent pyelonephritis. So it's diagnosed with a VCUG and IVP, and it's graded 1 through 4. So important to really determine whether a child has a UTI, and often collecting a cath specimen is necessary because that commits you to if there is an infection in the prepubertal child. And in some sources and some physicians recommend, or specialists I should say, some say 1 UTI that's prepubertal is enough to warrant a workup for this. Some say you need to have at least 2. Urinary incontinence is a common functional problem, which there's no structural or neurologic abnormality. So there's involuntary passage of urine. Who's beyond the age when bladder control should have been acquired. Usually that's by 5 years old. So it's manifested by bedwetting or enuresis at night. Theories of enuresis, organic causes. There are some. Maturational lag, genetic factors, sleep patterns, psychosocial theories. Primary enuresis is when the child has never been continent, and secondary is when they've been continent and now they become incontinent. And that can be a functional problem. It could be related to stress or changes in the family dysfunction. And that's all I have for children.